Social distancing means keeping a distance of 6 feet between you and the people around you to decrease the chances of you acquiring any communicable illness that's spread with respiratory droplets.
You might wonder what it means when we talk about flattening the curve. This is pretty new to us, but what that means is to minimize your exposure so we don't see these large spikes like we saw in China, where there were a few people that tested positive on day 1, and on day 2 there were 1,000 people. So what we're trying to do through social distancing and good hand hygiene is making sure that we have no spikes in new cases.
So good hand washing. So washing all surfaces of your hands with soap and water for 20 seconds, using a hand sanitizer with at least 60% alcohol content in it, doing both of these frequently as you enter and exit different spaces, making sure that you're wiping down commonly used surfaces such as keyboards, desktops, door handles, cell phones, making sure that you're keeping all of those items very clean and disinfected. Be sure, especially when you're using your cell phones, that you're not putting them down on common surfaces and then putting them back up to your face as you're using them. After you cough or sneeze, be sure to wash your hands really well. Also, if you use a tissue, then be sure to throw that away in a receptacle very quickly and don't lay it on any other surfaces, and then make sure to wash your hands or use hand sanitizer after using a tissue. Be sure to avoid groups of 10 or more, or even public venues right now, in order to decrease your risk of exposure.